entire staff. And for the next segments of the program, I would like to invite, before that, uh, as a token of respect, we would like to give bouquet to the ma'am by our principal ma'am. So ma'am, please. To run the program onward, I would like to call Honorable Vice Principal to introduce our special guest, Mrs. Amruta Raul.
Thank you, sir. And good afternoon, all of you. We started in the morning, so it was good morning, and the whole day is filled with a lot of energy, enthusiasm, love, care, and sharing of all of us. On this day, that is yesterday, actually, it was International Women's Day, and since it was Sunday, we couldn't meet here. But good that both the guests, they gave their consent for being here for today's program. And this program is under Gyan Samvardhan. We are trying to do this program. The purpose is like today's guest, Dr. Amruta Raul. She is a renowned gynecologist here in the vicinity of Boisar. I would like all of you to please give her a big round of applause, and it is a mark of our welcome. She, I'd first of all again would like to ask all of you to give a big clap for Indian team yesterday. We won the World Cup, and the captain of our country, that is T20s, Surya Kumar Yadav. I'm proud that I taught him in junior college, and he is he is leading the team there. When the advertisement started for men's T20 World Cup, before that we had one women's T20 World Cup, isn't it? So big round of applause to all those ladies, those who have done fabulous. And the advertisement was there, and it was saying, कि एक तो हम ले आए हैं, दूसरा हम जाने नहीं देंगे, मारे छोरे छोरियों से कम है के. This was the line, and that triggered me then. And yesterday it got fully, fulfilled. The women said there, now we have already led the path, and now men have to follow. And good that under their wonderful influence and eminence, now we have won the World Cup, and everywhere women are reigning this whole world, and without them, it seems that everything is incomplete. Today's this program is especially meant for all the women, not only working in this institution, but all the AES schools, and beyond that, any other this link can be shared with anyone. This is also meant for the students of class 9, 10th, 11th, and 12th girl students, because it so happens that in our Indian culture, we are generally hesitant to speak up about some of our problems. And when it comes for women, they are hardly heard, or because the environment is such that they cannot speak up. So this platform is going to be the most suitable one, from where all the problems of you people would be discussed by the expert of today, that is the chief guest of today's function, Dr. Amruta Raul. And if I want to give you a bit of introduction, why I referred to the World Cup today, because he is an alumnus, Surya Kumar Yadav, and Dr. Amruta Raul is also an alumnus of this very school. Give her a big round of applause. She studied here in this very school as well, and from here to school number 1, that is for 10th standard, madam completed from our own setup. So it gives us immense pleasure to welcome such eminent, personality, and giving you an opportunity so that you can discuss all your issues with madam. Madam is a gynecologist, obstetrician, and an infertility specialist. Madam has got experience of over 8 years, and she is known for her compassion, care, and evidence-based approach. and commitment to holistic women's health, guiding patients through every stage of life, from adolescence to motherhood and beyond. Dr. Raul journey began with her schooling in this very school, that is Atomic Energy Center School, Tarapur, and later she completed her graduation from Ruparel College, Mumbai. She also she pursued her MBBS from MG College, Mumbai, and after that she had also traveled abroad, and there voluntarily she has extended her services. Madam's clinics, two clinics are there. One is called child care, birth care, and the second one is Raul's clinic, isn't it? Renu Hospital. This name, Renu, is her grandmother's. Her grandmother was a dedicated volunteer midwife during that time when there was scarcity of gynecologists being available in this vicinity of Boisar. Since then, her grandmother had dedicated herself, and now, with complete expertise, the granddaughter is there to do the service to the society, and she has therefore given the name to her hospital, Renu Hospital, which is in Boisar. So we realize the importance of the voices of all women. Sometimes they seem to be silenced, but deep down they have got huge voice. And today's era, it speaks volume about them. In this very hall, we have got double the number of employees in this very institution, and they have been doing fabulous work. So a big round of applause to all of you people for extending all your services. So meticulously doing your work, and then being a part of this today's function. Without taking further time, I would like today's guest to take over this session so that you would be benefited more. I also request the gents member to kindly get downstairs so that women can discuss their issues quite comfortably. Thank you. Most welcome.
They all have wives, daughters, and their husbands. If you wish to, you can stay back.
Screen share.
Good afternoon, everyone. Actually, I'm very glad today. I'm so happy. Actually, I can't even. I'm actually uh, not able to express also because I think after so many years I'm coming here. That time Chadda sir was principal. Then we had, I don't know whether you people know Pandale madam, Janki madam. So these were my teachers, and I had the opportunity to come to this atomic energy and have such great teachers, and whatever I'm today, I owe them all. So first of all, I would like to um, extend my regards to all of you and my namaskar to all of you, because you all are teachers, and I think very highly respect all my teachers. आज भी मेरे को मेरे teachers मिलते हैं ना, तो मेरे को उनके पैर छूने ही है. You know, I feel so happy when I see them. I had such nice connection with them, and I always try. Even I have a daughter, 9-year-old daughter. She's in Viraj, and I always try that she also makes that connection, because with that connection, I feel it helped me till it's helping me till today. Uh, Recently I had once Rajamma madam, I don't know whether you know, she even she came with her daughter for some reason, and when I was so happy when she came, and I told her to meet the teachers, and to meet the teachers as they come to you as a patient, and I'm the doctor. I can't even express that how happy I get, because it's a honor for me. So first of all, thank you for this opportunity. Thank you, Sangeeta ma'am, and thank you to our vice principal sir. who made this initiative to, and while speaking, just I told him, no sir, even I was the student that time, just 2-3 days back, he came to know about it. So we'll start with the session. Because I got very emotional after coming to the school after so many years. So I thought first I must express myself so that I get comfortable talking to you all. So today, uh, there are so many topics, to speak regarding women health. But I have decided one or two because uh, one or two topics which I would like to address. Most of the time I speak in Marathi. uh, I have habit of talking in Marathi and Hindi during all the programs, but because this is, I think, all India, so I'm trying. So please excuse me if I make mistakes, and specifically if teachers are in front of me, I'm more aware. बहुत गलतियां निकलेंगी मेरी, तो मुझे उसके लिए माफ कर देना आप लोग. So today, I will take the most common. We will start from the beginning, like which is the most common one and which we are facing daily, and what is happening. So this is one topic. So polycystic ovarian syndrome. So if you remember, if you are ever getting a sonography done, you must have seen a lot of females are getting this PCOS, madam, I have PCOS, and they keep doing sonography after every 6 months to see what is happening to the PCOS. I'm sure even you must, because now in India, it's like after every over every 5 women, there are 2 to 3 people who are getting this PCOS, and we are getting girls as young as 16 years suffering from PCOS. So what is this? What is this PCOS? So today I'm going to talk regarding that. First of all, everybody knows it is a hormonal disorder, right? So what is it characterized by? It is characterized by irregular periods. महीना टाइम पे नहीं आ रहा है, महीना आगे आगे जा रहा है. These are the most common complaints. First of all. Other is hyperandrogenism and polycystic ovaries, that I will explain to you. So actually, थोड़ा वो ऊपर ठीक से ये नहीं हो रहा.
हाँ, next slide.
Slide थोड़ा सा वो actually, but उसकी clicking से होगा. So this is the normal ovary, as you can see. Okay, so it has a normal follicles. So every time, every month in our ovary, एक अंडा बढ़ रहा है. So one egg matures. So what happens in this polycystic ovaries is अंडा बढ़ता है but वो फूटता नहीं है. It gets arrested after certain time. So there are a lot of follicles, but none of them get totally mature, and none of them get ruptured. So what happens is, after system, what happens is there is a hormonal surge which causes the egg to rupture. So what happens with PCOS is, जो hormonal surge होना चाहिए, it happens only when the ovum will get matured. जैसे अंडे का size बढ़ेगा, तो that time only the hormones increases. अभी in this what happens, the egg will get arrested. So the hormones जो release होने चाहिए, that don't get released. Then the egg doesn't rupture. So that's why cycle gets elongated. Cycle बढ़ जाता है. तो normally जो cycle 21 से 30 days का होता है, that will go to 35 days, 45 days. This is the main reason कि क्यों periods आगे आगे बढ़ रहे हैं. So then happens every month, जो अंडा बढ़ना चाहिए वो नहीं बढ़ रहा है. There are a lot of immature follicles and they get collected. So पूरा collection हो जाता है, and that causes the PCOS, the polycystic ovaries. When this started, first it was PCOD, it was polycystic ovarian disease. But अभी वो इतना बढ़ गया, like after every there are like 2 to 3 females for every 5 females are suffering. Then after out of 5 females, every 2 to 3 females are suffering from PCOS today. So they changed the nomenclature and they have taken it from PCOD to, they have made it into PCOS. They made it a syndrome because it has become so common. See, that's what I was telling you. Normal follicles grow like this, 10 mm, then ovulation happens. But in this, because of the hormonal imbalance, there are a lot of follicles, but none of them, the PCOS ovary looks exactly like this. Peripherally arranged follicles will be there, lot of follicles, बहुत सारे अंडे हैं, but none of the, उसमें से एक भी अंडा बढ़ नहीं रहा है और फूट नहीं रहा है. So what happens with PCOS? Infertility. Why we are more concerned about PCOS? Because these are the females who are going to turn into infertility patients. PCOS generally requires treatment in the form of ovulation induction because the periods are irregular. Then they don't know when the egg is going to rupture. So, in general, infertility is going to happen. So, there will be diabetes in future. Then, because of diabetes, also during pregnancy, the PCOS females also have high risk of getting gestational diabetes mellitus and high blood pressure also during pregnancy. These are the syndrome, hormonal imbalance, irregular periods, acne, hair growth. Can you see, these are the PCOD main symptoms. The first one is irregular menses. See, it actually occurs in stages. ऐसा नहीं कि एक ही बार में एक चीज हो गया. पहले periods irregular होते हैं. Then you will see there will be darkening of skin. We call it acanthosis nigrans. Then there will be melt pattern baldness. जो सामने के बाल है ना वो thinning होने लगते हैं. Then comes infertility, acne, obesity, and hair growth. Hair growth in areas which we don't want, like on this bird region and all. So these are the main symptoms of PCOS. Okay, so how do you manage it? Now comes the real. See, why is it happening? You must all be feeling ना कि अरे ऐसा क्यों हो रहा है? It is because of our diet. पहले ना हम लोग जब स्कूल में आते थे चपाती सब्जी खाते थे. Nowadays you must have seen हम लोग बच्चों को 5-10 रुपया तो ऐसे ही दे देते हैं and उससे वो लोग है ना वेफर्स खरीदते हैं. Means most of the time now luckily this school in ECS it is not a problem, but if you go and see the outside school there is always a small tapri, from where the kids will get 5 rupees, 10 rupees, they will take the chips, and it is very common also that we always go for weekend dinner, lunch outside, and because of the food, burger, pizza, ये सब जो food है उसके वजह से क्या हो रहा है, this is causing excessive weight gain. It is not excessive. It also matters how much weight do you gain in a certain time. अचानक से अगर 6 महीने में आपका 5-10 किलो बढ़ रहा है, then you are more tend to go towards PCOS. So what difference? This is the where you can interfere as a parent, as a teacher, that the students should not have these things. Our kids should not be having this. उनको ऐसा लगता है रोज एक वड़ा पाव खाने से क्या होने वाला है, या रोज एक समोसा खाने से क्या होने वाला है. So these are the things. This is a long-term thing. Then once this happens, this happens all due to instant weight gain. We are getting kids of 16-year-old females with 70 kgs weight, which is not normal. So these people tend to have the PCOS. So this is the time we can interfere and we can make changes. The good diet and exercise. More than that, exercise also, because nowadays we don't exercise at all. We don't walk after. We are just sitting after every meal. We just take the mobile, we sit, and we spend hours on it. But we never walk, and because of all these things, there will be weight management issues, and then we have to go to the doctor. Lot of people think कि मेरे को periods नहीं आ रहे ना तो मेरा weight gain हो रहा है, right? Lot of means I get patients those who complain कि madam I didn't get periods for 3 months, then I have मेरा वजन भी बढ़ गया. So I always tell them, see, it is not because of that. It is because you have gained weight, you are not getting your periods. It is the vice versa. When you gain weight in a short period of time, a larger weight gain, that time it is going to cause issues, and that is going to cause problems, and then you feel that मेरा पीरियड मेरा वजन बढ़ रहा है, because you correlated, but the real thing is that because आपका वजन बढ़ गया है, उसकी वजह से hormonal imbalance हो गया है, and then because of that you are gaining weight. ये सब it is a basically vicious cycle, you know. So where you have to break it. Now a lot of people think दवाई लेके मैं ठीक हो जाऊंगी. So PCOS is not something which can be cured. It has to be managed. So how do you manage it? You manage with good lifestyle. You manage it with food, what food you eat, how many calories you intake. Then you manage it with exercise. So when a patient comes to us, what we do is we put them on hormonal pills to get the periods regular. But main reason is weight loss. That we need the patient. I always counsel the patient that you need to have the weight loss if you want. आपको अच्छा होना है इसमें से. अभी जो चीज अभी ऑलरेडी ओवरी इतनी बड़ी हो गई है उसको हम छोटा तो नहीं कर सकते. See what happens internally is the ovarian size is normally 1.5 centimeter to 2 centimeters. In PCOS now the ovaries become huge. They become 3.5 4 centimeter, literally double the size. And अभी जो हो गया उसको तो हम छोटा नहीं कर सकते. But